Friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant fetal medicine. So today we are going to talk about the fetal maturity. Okay. So whenever we see the baby at 34 weeks or 36 weeks, it's something around 8 month or 9th month, and therefore whatever is the weight of the baby that is turning out to be, right? And so how do we identify what is the actual maturity of the fetus? So let me give you some examples. So whenever we put the baby and whenever we do the biometry and put all those things onto a graph, so that graph can tell you that this lies at the 50th centile, which is appropriate for gestational age. This can be at the -2 SD or could be a +2 SD, or at the 5th centile or the 95th centile, and therefore the baby can be small for gestational age and large for gestational age simultaneously, right? But this is apart from this one particular fact. How do you identify, how do you say, how do you presume what is the actual maturity of the fetus? So meaning thereby that ultimately we need to identify what is the fetal uh, pulmonary maturity. So as to whenever we are planning for the baby and then the baby comes out, so what would be the sort of an ultimate criteria by which you really can identify what is the actual sort of an fetal maturity? So there are few age independent criteria, few age independent parameters that probably we can follow them out. So at the knee joint, okay, so the fetus has got a knee joint. That knee joint has got two major bones. The bone which is coming, which is a thigh bone, which is coming from the proximal जो ऊपर से आती है, and then we have got a big bone that is in the downside, which is called as a tibia, right? तो उस घुटने पे जो एक फीमर जो बोन ऊपर से आती है और जो बोन एक नीचे होती है, इसको टीबिया बोलते हैं। उनकी कुछ एपिफाइजेज होती हैं। एपिफाइजेज होने का मतलब होता है कि वो कुछ सेंटर्स होती हैं, and we can identify them to be a satellite to that particular bone. And अगर उसकी calcification हो जाती है, so meaning thereby that those satellites to the femur, meaning thereby the distal end of the femur capiphyses और tibia का जो proximal end है उसका capiphyses अगर आ जाता है, so that gives us the sort of a rough estimate regarding the maturity. सो द नेट द थिंग इज दिस कि जो फीमर है उसका जो डिस्टल एंड है उसकी एपिफाइसिस 34 वीक्स पे आ जाती है, और जो टीबिया का जो प्रोक्सिम एपिफाइसिस है दैट टर्न्स आउट टू बी 36 वीक्स. So let us revisit to it and then identify that the distal femoral epiphysis turns out to 34 weeks and the proximal tibial epiphysis turns out to be 36 weeks. So if the distal femoral is appearing, it is 34. If the tibia has not appeared, then it is between 34 and 36. And if the TBL epiphysis, proximal tibial epiphysis has also appeared, so meaning thereby that we are dealing with a fetus with a maturity at 36 weeks. So this is in the nutshell. So let us understand all these things with three examples, and then probably we'll talk about it later on. So this is the first case, which is at 34 weeks. So all the parameters are 34. We are placing onto the effective gestational weight. So we identify to be a 34 with that 50th centile. And then we identify that the distal femoral epiphysis has turned up. But simultaneously the proximal tibial is not there. So the fetal maturity is at 34. In the second case, we identify that the baby is bigger by 1.5 weeks. So we identify that the baby is large for gestational age, right? And both the distal femoral and the proximal tibial epiphysis they have come up, right? So you try to see कि ये distal femoral epiphysis भी आ गया है, और इसको ध्यान से देखिए तो proximal tibial भी आ गया है. So that means the maturity of the baby is 36 weeks. Now reverse way around, we identify a case which is showing a growth lag of 2 weeks. So the baby is at 35 weeks. So only the distal femoral has come up, but not the proximal tibial. So the baby is at less than 36. So maturity of the baby can be appropriate for gestational age, which can happen in case 1. It could be large for gestational age, which was the case 2, and which will be small for gestational age, which was the case 3, right? So case 3, we identify that the baby is growing bigger. Baby is growing bigger, but vis-a-vis the parents or the consultant or somebody fetal medicine specialist is worried about the actual maturity of the baby. So if you see both the epiphyses, they have turned up. So meaning thereby that we can be it is very, very reassuring that the altogether the fetal maturity is at 36 weeks. But the case 3 is very interesting. So the LMP is telling us that the baby is 37 weeks and 5 days, but we are identifying that the baby is small for gestational age. So even though the Dopplers and the amniotic fluid and the biophysical is doing absolutely great, but the baby is at fifth centile, or it is at -2 SD, and the baby's maturity is at 35 weeks, so there is a lag of something around 2 weeks. Now how do you see and how do you pronounce it is this, that the distal femoral epiphysis has turned up, so that is there, but the proximal TBL has not appeared, so meaning thereby that the fetal maturity is more than 34 but it is less than 36 weeks. So meaning thereby that we can take a call regarding these appearance of these epiphysis. So if the femoral, distal femoral has turned up, so that is 34, which was case 1. So if both of them they turn out to be there, even though the baby was showing bigger with a growth of 2 weeks, which was a case 2, and therefore we identify that the baby's maturity is 36 weeks. Vis-a-vis, on the other hand, we have identified that according to the LMP, the baby should have been 37 weeks and 4 days, but it turns out to be 35 weeks. So the baby is small for gestational age, so for all practical purposes, the baby is small, meaning thereby that the proximal tibial epiphysis, which should have appeared, has not appeared. So meaning thereby that the baby is greater than 34 weeks but less than 36 weeks of maturity. So this is how we can do a triaging as far as the as far as the fetal maturity is concerned. So maturity, meaning thereby after the baby is born, the baby would need most paramount important lungs to survive and to not to have any respiratory distress. So this is how we can do a triaging to the fetus. So if the baby is small and we identify that both of the epiphyses have turned out to be there, so even though the weight of the baby is less, we identify that the maturity of the baby is 36 weeks and should not have any troubles. While on the other hand, the diabetic babies, which are usually macrosomic, but their maturation is usually delayed. So in that case also, if the proximal TBL has not turned up to be there, it is not there. So it has to be bright, thick, and ideally should have been. We should be in a position to measure it. So anything which is greater than 7 millimeters, it's absolutely great. It is absolutely good. So in both the cases, if the baby is small, if the baby is macrosomic, if this proximal TB lymphocytes has not appeared, so take it but the maturity of the baby to be less than 36 weeks, right? Thank you very much for your patient listening.